Okay, so welcome back to the Default Global podcast, where we explore the stories and strategies behind building and scaling global first companies. I'm excited to have Dr. Sanjay Doddamani, the founder and CEO of Guidehealth, with us today. Sanjay has a deep background in transforming the healthcare space. Before co-founding Guidehealth, he also co-founded Upstream Care, right, which raised like more than 140 million. His current venture, Guide Health, is an AI-powered healthcare platform designed to optimize value-based care by predicting patient needs. Sanjay recently closed his 14 million seed round, and today we're gonna dive into that fundraising journey. Sanjay, it's a pleasure to have you on the show today.
Vitaly, great to be on. Thank you for having me. It's an exciting time for many reasons for us.
Did I miss anything in that intro, or would you like to add some details?
Well, by way of intros, I'm a physician first and have been very committed for the last 2 decades in transforming healthcare, especially to improve the lives of patients living with chronic conditions. Guide Health is a summation of a lot of those efforts. Founded a year ago, and we've moved very quickly to help support health systems transform care for their communities through their population health and value-based care initiatives.
Awesome. And before we dive into your fundraising journey, could you maybe give us a quick overview of your product specifically, and maybe share some key metrics you're comfortable discussing today, like number of clients, number of employees, I don't know, number of patient lives impacted, anything like that?
We are a tech-enabled services company, and healthcare services comes in many forms. We support both payer-led, what's called delegated services, that help with the contractual obligations to be fulfilled by providers. And then at the same time, help improve total costs of care and clinical outcomes, including quality, care gaps, and other important milestones for patient care. And we use a combination of artificial intelligence, predictive risk models, and health guides who are essentially medical assistants supporting each primary care practice to help improve care, access, and performance.
So, securing 14 million in your seed round is quite an impressive milestone, especially considering the current state of the VC market in 2024, right? But as an experienced entrepreneur who has already passed through this journey before, can you maybe start telling us about your journey? Just compare this experience in 2024 with your early fundraising efforts at Upstream Care, for example, right? What felt different about this fundraising effort compared to before,
Fast forward to today, we've seen a number of changes in the industry, in the capital markets. There's a lot more, not just scrutiny and need to demonstrate proof points, but also have, I think, a bigger focus on outcomes, not just on revenue generation. And so in that backdrop, we've emerged as, I think, a very promising company with very low operating costs, very low burn rate, and a good growth of clients as we drive forward. We made an acquisition last year of a managed services organization that had an existing retinue of clients and revenue. We're now in 4 states.
Mm-hmm. Mm-hmm. So, as I understand, Memorial Hermann Health System was a key investor, right, along with other healthcare leaders. So, as far as it is a kind of mix of healthcare focused investors and just different entrepreneurs. Can you talk about the first step of that journey, starting with were your initial connections with investors kind of cold, or did you leverage your existing network? Can you talk more about this?
It's very product specific and it's very service specific. So here we have a tech-enabled services company that essentially improves business operations, efficiencies, the productivity revolution that's much needed in healthcare. And so to find like-minded individuals who are trying to solve these, I think was the foundational level. And so it was nice to have Memorial Hermann in a commercial relationship as well as in a investor relationship. We have other health systems that are also involved as customers. And so we've come forward to help improve that service offering using our seed funding. It's very encouraging that we were able to be successful in our seed round.
Okay, so you work across various healthcare systems and organizations. So I imagine you were selective in choosing those investors, right? So what were you looking for in your investors, besides the capital? Were you prioritizing a strategic healthcare expertise, or did you focus more on investors with strong background in in AI and technology?
All of the above. I think the most important thing is the conviction that they mutually had in the direction we're going, that there's an important need to support health systems to improve things like access and performance and patient engagement across all lines of business. So the uninsured patient is as important to us as the Medicare Advantage patient and everyone in between. That was the first level. The second was we are involved with value based care contracts. These are two-sided risk contracts that take a lot of um, knowledge in managing a risk and managing total cost of care and helping to drive better outcomes, reducing readmissions, reducing ER visits, and actually tying those to financial outcomes. So we had investors who are very experienced in advanced primary care. We had investors who are very experienced in healthcare finance coming together and supporting our thesis.
And how did you prepare for this round? Did you follow some strategic a specific strategy? Compressing your outreach into a short window. Or were you nurturing relationships with investors over a long period of time? Just can you share this secret?
I think we are all learning how to be, great at this important part of the work. Think of it as a doctor who had to quickly figure out what fundraising is like. I think the more important question is, what is the vision? How are you going to get there? What is the purpose? What values do you espouse, and how are you going to, do you actually have a good product market fit? Do you have a growth strategy? Is there a good, baseline, financial outlook?
Sure.
And so for us, we had to quickly solve for that. Our vision is affordability in healthcare. How are we getting there? We're actually, improving, integration into existing workflows and using AI and risk prediction for better patient engagement and reducing the burden that's placed on physicians and patients to help improve those outcomes. But to actually then generate, a close fundraising cycle means that you have to have solid finances. We are EBITDA positive even in our first year. That was a very important thing. Keeping costs down, having a very low burn rate by combining AI and combining a low operating cost workforce was very important to us. There are a number of benchmarks in healthcare that tell you what you should be spending in particular lines, and so we've repeatedly exceeded expectations in that regard. And that when that happens, you can then generate more savings to your customers. And that is, I think, part and parcel of why we were successful in our fundraising cycle. In other words, strong idea, strong execution, strong product market fit, and the money will flow.
Yeah, and speaking about the healthcare industry, right? It is such a complex and regulated industry, especially when you're dealing with value-based care models, right? So, what unique challenges did you face in pitching a Guide Health AI-driven platform to your investors? Can you talk more about this?
So we catalyzed a lot of this because we acquired an existing managed services organization with a lot of history of working with payers and facing regulatory requirements and important challenges, and also working with physicians in a very customer friendly way. It really, I think, helped when we got recognition for the number one ranking in value based managed services through the Class Research organization. That's one milestone that's I think, a reflection of our strong customer service. The second is the customer needs that we're satisfying for payers, and then to be a national provider. And that's why we prevailed and we were successful.
Okay, and just maybe some real practical advice to founders for those who are in the health tech space who are listening to us right now and want to hear maybe some super like a practical advice on their fundraising attempts. Can you give some suggestions on the maybe pitch deck, right? So you touched this a bit, but still, when you were creating your pitch deck, what elements, what KPIs did you focus on specifically to reassure like a health tech investors?
Starts with a vision. Then, we leaned heavily on the whole mission and what we're trying to solve for. And then we have an operating model, a clinical model, a financial model that was accompanying that, and then a growth plan. And where we are at in our cycle, and what we're currently generating in terms of revenue, in terms of savings, in terms of overall EBITDA, and what we forecast over the next 3 to 5 years. So all in, I would say, what the product is explaining in a very succinct way what you do, and how it's going to change and improve, and if you have proof points to demonstrate.
I've been tracking this the fastest closing seed rounds of 2024. The record so far stands at 45 meetings with different investors. While the highest number of rejections reached 150 like meetings before a close. So how many meetings with different VC firms did it take for you to close your seed round?
I would say about 45 to
Okay.
50 outreaches.
Okay.
And we started the process last year in earnest in September. And we funded majority of what we needed to fund by January. And then we closed that funding round by the end of April. Well, to be fair, I would say by early June.
Yeah, that sounds about right. Not too smooth, but not too rough either. Yeah. Okay, cool. So every fundraising journey comes with its lessons. So looking back, was there anything in this process that you would approach differently next time?
I would say do your market research so that you can narrow down a list. Pre-socialize your plans with a few key potential investors so that you can get their guidance early and come back to them once you've satisfied those uh, you know things that they're looking out for. And then working with your customers in your process for even your funding gives, I think, a new level of energy. So we've been fortunate. We had, one of our customers lean in and actually invest in our seed round, and you know, uh, I guess you don't know how the market's going to react until you get out there.
And so, probably my very last question. You've been on both sides of the healthcare industry, working within federal systems and now as a tech founder in the health tech space, right? You touched this a bit, but still, like, what other maybe three pieces of advice would you give to other founders who are looking to raise funds specifically in 2024, and especially in highly regulated industries like healthcare?
Number one, do not fear or worry about what others think. Own your successes, own your failures, and build a map of what has worked and not worked. Share wildly. I hate black boxing things. I feel our ideas are improved every day because we're socializing our ideas and actually testing that with the market. And whether it's with customers, with other technology companies, and be very true to your mission. That's where I think we have made a very important traction. We support over 500,000 lives today in our business, and we've generated over 30 million dollars in 2024 revenue. How did that happen? It happened because we are working as a team very closely with our customers, integrating into their workflows, making sure that we're aligning with them. And so, as a founder, be fearless in your interactions, in your engagement, in building your model, in owning your successes, and in owning your failures as well, so that you can move, fail fast, fail forward. So, number one, strong conviction. Number two, partnership. Number three, accountability.
Fantastic. Thank you so much, Sanjay, for
Great being
sharing
on.
your insights with us today. We really appreciate your time.
Thank you.